Hello and welcome to Pune Mirror's thought-provoking series, Wellness Heroes, celebrating those who heal, inspire and care. In today's episode, we will dispel the myths and misconceptions about Ayurveda, which is an ancient comprehensive medical system that includes various specialities including general medicine, surgery and psychology. We have a very special guest with us today, Dr. Ghanshyam Bhalgat, who is a renowned Ayurvedic doctor in Pune. Dr. Bhalgat, welcome to the show.
Thanks, Mr. Prince. Thanks for inviting me over here.
It's a pleasure to have you with us. I'm your host, Prince Chaudhary, so let's get started.
Sure.
So, my first question to you is the myth is that it is not effective. Ayurveda is not effective.
Effectivity depends upon multiple things. Now, for few people, effectivity means short-term benefits,
Right.
like just regression of symptoms. And there could be important that you should be getting the rid of the root cause of the disease.
Right.
For example, I will tell you just now, I saw the case, a 52-year-old lady came to my clinic.
Okay.
She was having the problem with the knee joint, arthritis.
Right.
She was suffering it since from 5-6 years. And she was on the painkillers. Every day she was taking painkillers twice. She didn't meet her doctor also. And she keep on continuing because she was finding better. Now the pain aggravated. She went to the doctor. Doctor said, no, it's now too much. Now we will have to do the knee replacement surgery.
Oh.
She came running. She don't want to do it at the age of 52. She came to me. I said, this is wrong. She said, I got the relief. So relief, symptom management and treatment.
Right.
Both are completely different things.
Right.
And whatever the treatments Ayurveda is planning, that is for the root cause, helping the system to get immunized, getting rid of the disease and following proper protocol.
Right.
At the same time, the doctor tells you lots of dietary or regime related
Right.
things which you should follow. If you follow that one, that gives you good health, good benefits. Not like that one. Now suppose one patient of asthma was there, he was having the work in AC very commonly, and he was saying, sir, my symptoms are not getting reduced.
Right.
He was having the problem. Repeatedly I took down his history again, and he was eating curd daily, some cold drinks,
Acha.
and night ice creams, and working in AC. I said, this is very difficult. If you follow the things, you'll be getting the results. So effectivity depends upon the intensity of the disease, duration of the disease, the patient's morbidity, constitution, and the time structure also.
Right.
Like rainy season increases vata dosha,
Right.
cold season increases kapha dosha. So we have to see what kind of doshas are there predominantly. But the treatment should be like that one. Effective treatment means once we treated the disease, the reappearance of the disease should not be there. Then we
Right.
called it as a cure. Not like one day you took the painkiller, symptom was reduced, and again second day it arised. So that is not called as a cure.
Right.
Effectivity means cure of the disease for permanent.
Right. So there are three doshas in Ayurveda,
Yes.
right? What if you can?
Ayurveda thinks that body is a format of dosha, dhatu, and mala. Dosha, three doshas, vata, pitta, kapha. You can call it with the pancha mahabhutas, which are natural. Ayurveda says yata bhute yata sharire. Means whatever you see in the atmosphere, nature, that is same in all animals, plants,
Right.
human beings. So vata is like a formation of air and ether element. Pitta is fire and water element, and kapha is a water and earth element.
Okay.
That constitutes the body. If the imbalance is there in these three doshas, you tend to see the diseases. Like if kapha increased, you start to see the running nose is there or mucus is there. Pitta is increased, you see hyperacidity. These are just a simple level for understanding. There are different kind of doshas, and these doshas can be separately or combinedly attend or make the disease to increase.
Another myth, misconception is that only vegetarians can use Ayurvedic medicine.
Very good question. Lots of people comes to us and ask, no, can we take the non-vegetarian? Ayurveda never says that you should take or you should not take vegetarian or non-vegetarian. It tells you have to take as per your agni, as per
Achha.
your digestive power.
Right.
Suppose now, if you are having acidity problem or some another problem which is giving the digestion difficulty, and you are eating chicken, mutton,
Right.
non-vegetarian items, that may not be completely digestible for your body.
Right.
You have to eat as per your agni. If your agni is permitting, you should eat
Okay.
the diet. If suppose it is related to the Ayurvedic medicines, the Ayurvedic medicines are completely using the animal products also.
Okay.
There are products which are only for vegetarians. There are mixtures also, and they have been utilized since long. So there is no such kind of thing that it is only for the vegetarians or
Acha,
not.
okay. Now, another myth that some of our viewers believe in is that it can be taken as a OTC, over the counter product. It is expensive and it is harmless.
Very good question. Very good question. And nice question to ask, because this is a big myth in the peoples. They commonly take the medicines that this was effective for him, so I took it, and
Acha.
they come to us. Uh, if you are taking the product, if that is suitable to your body or no, that you need to understand. Somebody's body is of different constitution. Vata, Pitta,
Absolutely.
Kapha forms different constitutions, and so if it is not of your prakriti, what will suitable to Pitta prakriti or fire body
Right.
will not suit to the Kapha prakriti. For
Absolutely.
example, if somebody is having running nose and he took the ginger juice with honey, it may be suitable for him.
Right.
But if that is taken by the Pitta body,
Right.
he will may find the acidity is increased.
Oh.
So you need to know what kind of body is there. Again, another kind of medicines. He took some pills, so I took that one. It is not effective for me. No, no, no. On OTC medicines is to be strictly avoided. You should consult your doctor. He will take the complete decision. Ideally, when you go to the doctor, he will understand your body. He will do the darshan, sparshan, prashna. Three kind of examinations are there told in Ayurveda.
So there is a diagnosis involved.
Ayurveda is a science, and it is having its particular methods
Right.
to make the diagnosis, to understand the imbalances of the doshas,
Right.
and as per that one, then they will be deciding.
Right.
So it's having the effects. So actually, if you are taking some kind of medicines without knowledge, you are inviting adverse effects.
Correct.
Any medicine, maybe allopathic or Ayurvedic, if you don't take it with the knowledge or understanding, that knowledge is with the doctor, of course.
Right.
With the completely certified doctor, you should go. He will take down the history. He will understand your diseases, and then he will prescribe the medicine. That medicine, and up to that time, you should take. It's not like that. Oh, that time you given me the medicines. So after a few months, I found the problem. I took it again. That should be also avoided.
That should
because
be
the
avoided.
condition could change.
Change. Absolutely. So expensive and harmless.
That is also again. I had seen that there are high charges being charged at the different spas or the centers which are targeting international tourists, or that kind of criteria is there.
Right.
But if you ask me, in general, medicine charges depends upon the type of disease, its intensity, imbalances of the doshas. Sometimes the chronicity is too much, then we have to use some kind of medicines which are maybe costly at that time.
Right.
But overall survey which has been done in between has shown that half of the peoples find that Ayurveda is not that much expensive.
Okay.
And we are treating the patients every day. We are having the patients of all class.
Right.
I will tell you, I am having the patients from the slum areas also. They are taking the medicines regularly, because if you are being told for operative or something and you are not going to afford it, you are going to look for some another options.
Absolutely.
And those options are from Ayurveda.
Right. So one more myth is there, misconception is that Ayurvedic medicine only depends on oil therapy. It's something to do with oil therapy and massages. I don't know where this misconception has sprung from, but
Because when we see the advertisement and all, they show Ayurveda in that kind of structure. The oil is massaging and all. This is all about Ayurveda. Ayurveda is completely a science of the health.
Okay.
It is dependent on different kind of aspects of the body. So for that, you have to go with the diet, you have to go with the exercise, you have to go with the panchakarma detoxification, in which there is a oil therapy.
Right.
In panchakarma, only not oil therapy is there. There are vamana virechana, nasya, rakta mokshana, shirodhara. This kind of types are there. So everywhere oil is used. It's not like that one. These are cleansing procedures where the massaging is a pre-karmas or purva karmas of the panchakarma. It's
Right.
not the only main karmas. So only oil therapy is not based on that one. There are other kind of things that are also being used,
right.
like diet and all, that you have to follow.
Okay. It prohibits certain kind of food items.
Yes.
So we talked about non-veg only, but yeah.
No, no. This concept is must to understand. That yes, Ayurveda tells you that you have to go with the certain kind of food denials, because if you don't follow that one, you may find that healths are being deteriorated, or you started to getting the diseases. Just some common kind of things like that one, that people take milk and fruit salad
Right.
together. I will tell you one case. One of the patient came to me. Both husband wife, they run the mess, and they are having the students coming to their mess regularly, and it was a holidays, so 1 month they were tired of routine activities, so every day evening they were making the fruit salad, which was easy. So
Oh.
they took the fruit salad, and he was having the boils on the body, pus-filled boils, and he was not getting the relief. Almost for 15-20 days, the boils used to become big. He used to get fever, drained up, antibiotics. Again, he came to me. I took down the history. I
Right.
said, you will have to stop this. They said, why? I said, fruit and milk together are wrong for the body. We done the panchakarmas, and within 1 month, his disease completely gone. He said, I was suffering from this for almost 6 months or 1 year. No doctor told me. So understand, the concept of the denial of certain foods is necessary, like viruddha ahar, which is not allowed, that you should take milk with fruits, milk with salt, certain kind of things like honey and ghee together, warming the honey. So these foods, they are going to cause toxination inside your body. You should stop this. You should understand that this is not going to suit your body. If that kind of thing is been pursued for long, you are going to see the disease problems.
What about milk and fish, or milk and
Yes,
non-veg?
you have to avoid.
You have to avoid that also.
Many concepts of us
Yeah.
are already clear. Our ancestors were telling us, ये नहीं लेना है.
Correct.
But now the new era peoples, no, आप क्या बता रहे हो? ऐसा कुछ नहीं होता है.
Hmm.
But why they had told you? Because there is some kind of knowledge that is coming from their observations or from the past books.
Correct.
If they had read it or they had observed, if they
Right.
are telling you, you should just find it out if it's right or wrong. Don't just ignore and say, no, I'm going to take it. It's not going to cause me any problem.
Is it true that Ayurveda is only effective for minor diseases?
And nothing like that. See, we are treating the patients of all kind of minor diseases plus chronic diseases. All kind of diseases are being treated, and we see that chronic diseases are having very good results. Arthritis, diabetes, blood pressure, cancer, they are having very good results, and the treatment part is been already effective. So nothing like that. When that only minor diseases are being treated, all kind of diseases are being treated in Ayurveda.
All kind of diseases.
All kind of diseases.
Ayurveda is the treatments are all natural, so they are safe.
No. This is a big myth.
Okay.
See. Natural doesn't mean that it is safe. I will tell you certain kind of things like datura, big poisonous, natural.
Yeah,
If
correct.
you think it's a natural and you take, it's a big poisonous.
I know.
Jamal Gota,
Yeah.
big poisonous. So natural means safe. It's not like that one. You have to understand the guna karmas, virya vipakas, which are told in Ayurveda, Dravya Gun Vibhag, so that you can understand what is the benefits and major impacts of that kind of herbs. If
Right.
you are not aware of that one, don't take it blindly. If you are not aware, better to avoid.
Correct. Better to avoid. Absolutely. Ayurvedic medicine is only good for elderly and aged people.
That is again a big myth. It's not like that one. Ayurveda is been prescribed as a Ashtanga Ayurveda. Means
Okay.
8 branches of Ayurveda is been there.
Right.
And that comes like general physicians, then Shalya means surgery, Shalakya, ENT, ophthalmology, pediatrics and geriatrics. So it is combined of 8 angas.
Right.
And those 8 angas are for all parts of the all human beings. It's not like only for the elderly peoples or for the childrens. It's explained everything, and the treatment has been prescribed for everybody.
Okay, it's prescribed for everybody. So that's a myth. It's just a bunch of herbal remedies.
See, again, herbal remedy is one of the part of Ayurveda. It's not the complete part of Ayurveda.
Okay.
As I told you that Ayurveda consists of lots of things. We use oils, we use ghee, we use milk, we use animal products. Why the herbal products are more in Ayurvedic medication? Understand, as I told you, Vata Pitta Kapha is a Pancha Mahabhuta.
Right.
And as I told you at the start only, that as we are being formed of Pancha Mahabhuta, this Prithvi, Aap, Tej, Vayu, Akash, so same is been in the plants.
Okay.
When Vata Pitta Kapha gets imbalanced, Ayurvedic doctor finds out what imbalance is there.
Okay.
And according to that one, the herbal medicines are being used.
Right.
But it's not only limited to herbal.
Right.
Now everywhere there is a concept that Ayurveda is herbal, safe to take. No, because of that, lots of peoples are branding their medicines as herbal medicines or Ayurvedic medicines and selling it. You should be aware of that one.
Right.
You should understand if it is really useful for you. All herbal is not Ayurveda.
Mm.
Maybe Ayurvedic is herbal, but
Right.
all herbal is not Ayurveda.
All
Understand
herbal.
this thing.
Okay. Great. Yeah. It's a pseudoscience.
Ayurveda is having big tradition, and it's a science from last 5,000 years.
5,000 years.
It has been used. It has been treated or applied at many places, not only in the India, all over the world. Now the peoples are coming with the AI machineries and all learning facilities for understanding Ayurveda. Indian government under Ayush Ministry has made up the course. So for Ayurveda, you have to do 5.5 year proper course. Then you get the certificate or registration to do the Ayurvedic practice. So it's not a pseudoscience; it's a proper science based on lots of particular thinkings and thoughts given by our Rishimunis.
So there is scientific evidence to support it.
Of course,
There
there
is.
is a scientific evidence, and this scientific evidence are been not only mentioned over there, but it has been evaluated in a present era also. Understand what is science? Whatever the things, whatever the observations are there, you evaluate on the specified scientific schedule.
Right.
Now, when we are talking about this, that Ayurveda is a science, I will take 1 or 2 minutes of you
Sure.
more over here, because this is very important part and it has been discussed at many levels.
Right.
Many levels means at the doctor levels also and the people levels also. For
Okay.
people, I will tell you first that see, it's a traditional Ayurveda system. To understand it, it is must that you should see that the given medications at the time of 5,000 years back are still effective. We are still to get more knowledge about Ayurveda, but whatever we are using in the treatments is beneficial. If it was not been beneficial, it was been not utilized all over the world.
Correct.
Not only Ayurvedic doctors are using it, allopathic doctors are using it. I'm having the centers abroad also. I keep on going over there. We are having webinars, lectures, and what we get the knowledge from the whole world is they are eager to get the knowledge. They want to utilize this knowledge.
Right.
They are doing the research on this one. Uh, Allopathic science is a evidence-based methodology they use, and they find it out if it is really effective or not. And they had done the study, and they found that the medicines are effective, and they had started taking the patents. Not only there, in Pune also there are 2-3 allopathic doctors, not only Ayurvedic doctors, allopathic doctors who has taken the patents of Ayurvedic medicines. Why they took the patent on those medicines? Because they found this is effective, this is beneficial.
Right.
So why not to use it? So
Right.
better to understand that science behind Ayurveda is very strong, perfect, and it has been proved many times. But at the present era, when we think to prove it on the allopathic science, we have to understand that few factors are not going to match. Like you cannot prove that, suppose I tell you that pancha dhatu is there, 5 elements, air is there. You will say, where I can say, I can't see air, show me
I can't
air.
see it, right.
How you will prove? So there are different methodology to understand that one,
Right.
and those methodology is not available in the present science. But
Right.
that doesn't mean Ayurveda is not a science. It is proved, its medicines have been effective, it has been utilized by allopathic doctors also.
Correct.
Shatavari kalpa, used for milk production in the pregnant ladies.
Right.
So that has been found effective. Lots of Ayurvedic allopathic doctors are using it. Live 52, very commonest product,
Right.
been utilized. Cystone for the renal stone, allopathic doctors are using. When they are using, they had find that the results are there because there are senior doctors who are using it.
Right.
Forget about them. Ayurvedic doctors are there, and Ayurvedic medicine is been popular in all over the world.
Right.
There are lots of Ayurvedic doctors in abroad also, and few Ayurvedic doctors, they were past allopathic doctors. I can give the examples, but I should not take the names of those.
Right.
They were the past allopathic doctors, big physicians, and they had started using Ayurvedic medicines. So it's based on science.
Right.
It's been proved, and lots of research is going on the animals, and they're finding it out. It's effective.
Correct. No toxic materials.
No, it's not like that one, that there is no toxic material. Every medicine is having the toxicity. I will tell you, in Ayurveda there is a herbal medicine as well as metals which are being used, and these metals were intentionally told to utilize in Rasa
Okay.
Shastra. Now the concept is that when you are using mercury, you are using gold, these are going to cause the problem with the kidneys and all. No, when Rasa Shastra was evaluated, they told the Shodhana karma for the these metals also, means that medicine like mercury has been processed in some kind of rasas or kalkas or the mixture of herbs, and then it is purified so that it will be acceptable by the body.
Right.
And after that one, it has been processed, and then the ash, that ash which is going to be accumulated by the body without any side effects in a given kind of prominent doses.
Okay.
If you find some companies are making the medicines on the name of Ayurveda and they are selling something, and there are some kind of metals which are been found, that is the problem with the regulatory system. FDA, Ayush Ministry is working on that one. They had got a stringent rules and regulations, so they are finding it out. You find these kind of things everywhere. So it's not like that, it's not toxic, but Ayurveda has methods of safety protocols which, if followed properly, there is no such kind of thing that is going to cause toxin.
Okay, so and we already spoke about those three doshas: gas, cough, and acid. Which can Ayurvedic doctors perform surgeries?
Presently, Ayush Ministry has allowed, and they had given the proper registrations, and they have been practiced, so they can do surgeries provided they have been properly registered for that kind of thing under the government ministry.
So Ayurvedic doctors can perform surgeries actually.
Ayurvedic doctors can perform surgery, and they are doing already surgeries.
Oh, they
at
already
many
do
places.
surgeries.
Yes.
Wow, wow. Okay. Is there any other thing that you would like to share? Any important myth that can be, which is a myth which you can share with our viewers?
Very important myth is the same which we were talking about toxins. The metal thing, that metals have been there. Presently, what has happened in between, like 15-20 years back, I'm treating lots of cancer patients from US and Canada, and all other patients are there, diabetic, arthritis, but cancer patients were more. And some kind of batch was found to be having the metals and all, and lots of questions arise. No, Ayurvedic medicines contains metals, and we are going to ban the products and all.
Okay.
Canada has taken the action and all. And at that time, my patient were there. We are having the medicines isolated only as a herbal brand, where there is no metals used, zero metals.
Okay.
And these medicines are popular in abroad countries, and they are having lots of laboratories over there to ascertain that yes, my medicines are completely herbal, and they are taking those medicines so that they are completely free of any kind of stress. Whenever they have been under kind of some kind of group, and the people are telling them, oh, no, Ayurvedic medicines, they tell them that my doctor is giving me only herbal medicines, which is without any metals.
Absolutely.
So only herbal medicines are available which can treat the patient without any kind of mercury, without any kind of gold, without any kind of severe toxic medicines. And these medicines are effective, proven to be effective, and we are treating the patients since long. So
Okay.
that kind of thing is important, that people should not think that only metals are there, so it's unsafe, or whatever the other kind of myths are there. If there is kind of only one thing you need to understand, is that one longevity.
Okay.
Ayurveda's main base is swasthasya swasthya rakshanam aturasya vikar prasannam. Ayurveda doesn't think about diseased patient. Ayurveda talks about the patient who are healthy, how you should be healthy, how you should maintain the health.
Maintain the health.
For that, they had told dinacharya, rutucharya, that will elongate the questions, but I will just tell you simply. So Ayurveda has told all the things, like how you should eating the food, you should be tanmana bhunjit, you should be putting all concentration on the food. Now that is the science is also telling you should be eating before sunset,
Right.
because that will help your digestive power. So
Absolutely.
these all things are important. If you follow that one, Ayurveda emphasizes prevention is better than cure. You should not fall sick. If you follow the things, you will be not sick, so you don't require the medicines for the future diseases and all of these things.
So you're saying that people who are don't have disease or not sick can also come to an Ayurvedic doctor and find out that how they can remain healthy. Yeah.
See, I will tell you, I am having the patient whose father is diabetic. He's having long history. He stays in UK, and he said, doctor, can I do something so that I will be not following the diabetic, because it's a strong history in my family. I said, of course. As you have to go ahead with the diet, you have to do with the exercise, and some kind of herbs that you should go on taking regularly. These are rejuvenative herbs. I told you Ashtanga, means 8 branches of Ayurveda. In that one, Rasayana, means rejuvenation therapy, is the main part of the Ayurveda, where how you should feel, how you should be safe and healthy every day by taking some kind of medicines is been written. I will tell you one example, Chawanprash, very commonly
Chyawanprash,
known.
yeah.
Why the people take increasing the immunity. Why you need to increase the immunity? To fight with the disease. So
Right.
concept starts from there, that you need to be healthy, so you should be taking some kind of things that will keep you healthy all the time.
Absolutely.
And that is needed for the peoples. IT peoples come to us, they do Ashtotan Karma for the eyes, so that if they are not facing the problem with the eye right now, they should not face in the future.
Correct.
People's doing the Panchakarma regularly, so that if they are removing the acid or excessive kapha, so that they will not fall the sick for that kind of part.
Absolutely. So, how impactful and what kind of role did Ayurveda play during that COVID pandemic, which
Very
shocked
good
the world?
question. See, we had seen lots of ups and downs, and during the COVID there were lots of patients who were coming to us asking, and it was the era when everybody was stunned. Allopathic doctors, Ayurvedic doctors, nobody was aware what's going on. They are giving the medicines, some patients are showing good reports, some are showing cytokine storm, suddenly a good healthy patient is, that what Ayurveda is telling. If your body is formed of some kind of constitution, some kind of prakriti, the same medicine will not be effective for all.
Correct.
That is what Ayurveda says.
Right.
The one medicine, if it is effective in X person, will not be effective in Y person.
Absolutely.
So when COVID was there, lots of trials and research were done, and Ayurveda was found effective and it was helpful. But yes, it has to be evaluated still more so
Right.
that it will conquer the confidence of the patient, so that trials and clinical researches will be more helpful.
Absolutely. So we spoke about general medicine, we spoke about surgery, we spoke about herbal medicine. What about the psychology of a person? How does it?
Ayurveda's main intention, prasanna atmendriya manaha swaste ityabhidhiyate, means it's not only that physically you are fit, means you are fit. Prasanna atmendriya manaha, if you are spiritually happy, if you are mentally happy, satisfaction is very important. Right now everybody runs behind the things and they are having some other goals to achieve. We are seeing lots of patients of heart diseases, and chinta is the main cause, means thinking, overthinking is the main cause of
Overthinking.
heart failure. That is told in the Ayurveda. So if you are not
Overthinking.
mentally fit, if you are not doing yoga or other kind of things, you tend to feel that that kind of problems are going to happen. So mentally you need to be fit. So whatever you are eating should be in a proper way, helping your rajasa, tamasa and sattva guna to be balanced.
Okay.
That kind of diet is there. Onion, garlic, does they cause tamasa or rajasa imbalance? Yes, they do cause. But you have to understand, is it there inside your body? If it's there, what you have to follow?
Okay.
If you are understanding of that one, then you have to go with the routine, yoga and meditation. That gives you a relief in the mind.
Which is very
Distressing
important.
therapy. If you follow that one, the benefit is too much.
Okay.
So, spiritual health and mental health is the important part
Wow.
of Ayurveda.
Wow. Dr. Bhalgat, it was a real pleasure having you with us and making our viewers aware, clearing all the myths and misconceptions that go around where general health, medicine is concerned, especially Ayurveda. Thank you so much for sharing your thoughts with us.
Same here, Prince. I'm very delighted to answer your all questions. I will tell the all viewers only same thing. I'm practicing since 25 years Ayurveda, and I had seen that Ayurveda is marvelous, beneficial, and lots of peoples are getting the benefits of that one. So you should just follow only one thing: health and wealth come together. It's not deprived.
Yeah, it's not deprived, right? Okay. All right. Okay, thanks, Doc.